Hello, this is Dr. Jonathan Laye coming to you once again with an educational session. However, this week I'm talking about colorectal cancer. Um, as some of you may know, March is Colorectal Cancer Awareness Month. And so I want to spend this month talking about colorectal cancer. So colorectal cancer is cancer that affects the large intestines. And so we call the large intestines the colon, and the end of the colon is the rectum. So cancer that affects this part of the intestines is what we call colorectal cancer. And colorectal cancer is actually the third most common cancer in both men and women in the United States. And it's also the second leading cause of cancer deaths when you put men and women together. And so it's an important um, issue to talk about. And, most colorectal cancers will start as polyps, which are small growths in the colon. And if these are not removed, then they undergo changes that eventually turn into cancer. Now, the important point to note is that over the last 3 to 4 decades, the incidence and the death rate from colorectal cancer has been going down. However, over the same period, the incidence and the death rate among younger patients has been rising. And so that's really something that's important. For example, in 2019, 1 in 5 colorectal cancer cases were younger than 55 compared to 1 in 10 in 1995. So there's been a shift, towards younger patients. And in fact, colorectal cancer is now the leading cause of cancer deaths in adults younger than 50 years old. So that's kind of sobering, you know. I mean, since 1990, overall cancer mortality has decreased by about 44%. However, in adults under um, 50, colorectal cancer mortality continues to rise. Now, the important thing to know about colorectal cancer is that, you know, it can be prevented. We talk about screening, and screening is where you have no symptoms, but we are looking for either polyps, as I mentioned before, to remove them before they can turn into cancer, or if cancer is already there, we are going to be able to diagnose it at an earlier stage so that we can cure it. And so screening really saves lives. There are different ways that we screen, and in subsequent videos, we will go into those. But I think the most important thing to understand is that screening saves lives, and colorectal cancer is preventable, it is treatable, and it's beatable. Okay. The guidelines for screening is that if you are 45 years or older, you need to start screening. Um, and um, and so if you are 45 or older and you haven't screened yet, I encourage you to talk to your doctor and go get screened. On the other hand, if you have a family member or a friend who is 45 or older who has not been screened, encourage them to go talk to their doctor so that they can get screened. As I said before, screening saves lives, and colorectal cancer is treatable, it's preventable, and it's beatable. Thank you, and I'll come to you again with other videos talking in some detail about other aspects of colorectal cancer. Have a blessed week.